This is a pelvic ultrasound of 25 years, primary gravida with positive pregnancy test, highly raised beta HCG levels, and referred to rule out any evidence of ectopic pregnancy as no gestational sac is seen intrauterine. This is the uterus, and we really don't see any sac within the endometrial canal. This is the endometrial canal, free of any echoes or gestational sac. Measures 7.8 in proliferative phase, uterus measuring 7.8 centimeters in length, 3.7 centimeters in anterior-posterior diameter. This is the urinary bladder, and this is the longitudinal view of the uterus. This is the cervix, vagina, cervical canal is clear. Now, when I rotate the probe 90 degrees, I see a highly echogenic, very echogenic area adjacent to the uterus with hypogastric vessels posterior to this echogenic area. This area, now this is the left region of the left adnexa. This is the uterus in magnified view. This is the endometrial canal, this area, and these are the hypogastric vessels. This is the echogenic area, highly echogenic, without any posterior wall shadowing. No shadow is seen posterior to this echogenic area in the region of the right adnexa, with hypogastric vessels posterior to it, measuring 18 into 16 millimeters. It's very dark, very echogenic, and the cystic, tiny areas, these tiny tubular areas within this one, there is suggesting of the fact that this may be a vascular solid mass, solid area, and it has irregular outer surface. See, the outer surface is irregular, no posterior shadowing, and highly echogenic, with internal tubular structures, and this is definitely a solid area besides the uterus. This is the endometrial canal. Now let's measure the canal in transverse section. It measures 14 millimeters, which is slightly above the normal limits of normal is up to 14, and this is measuring 14. So no gestational sac seen though so far, but this echogenic area, which does not. Now I'm going to move the probe, and let's see if we can get something. Does it change its shape, or it retains its shape, or it changes its shape? Let's try it and lower magnification. This is the area, and it does not change its shape. It is retaining its globular shape. This is the area. In magnification, we do see a tubular structure extending from this dense, hard, echogenic solid area. Two tubular areas are emanating from it, and moreover, we see a tubular structure anteriorly. This is most probably the right fallopian tube, and posterior to it, we see this echogenic area, solid echogenic area with internal tiny area. Similarly, if it had been given some posterior shadowing, we would have thought of dermoid cyst sort of a thing. But in this case, now this is the right adnexa, and here you can see that this is the uterus, this area is the uterus, this area, and this is the tube, fallopian tube is dilated, and here we see two echogenic areas combined together, almost combined together, of similar nature as we saw in the right adnexa. In longitudinal section, they almost retain their shape. So what can these be? It's really very hard to tell, but possibility of bleed, clots cannot be ruled out. And the differential will be even more expanding had I had any further detail regarding gynecological examination and lab profile. So this is an area also having tubular structures within it, so appears to be vascular. We have tubular structures in both. So there is one is this one. This is it, and the second is there. Both are irregularly outlined. Both are solid with no posterior shadowing, and these are seen within the right adnexa. Can it be a twin pregnancy? Is it an ovarian pathology leading to the ovarian cyst? This is the right, and here we come towards the left side. So this is a confusing sort of a study without Doppler, and I do not have a Doppler. Endometrial canal is definitely alive and more than active normal. So we can only give differentials. Right adnexa. This is the left adnexa. This is the region of the ovary, and this is also the region of the ovary. So these can be possibly clots within the right ovary. This can be a clot within the left ovary, and otherwise there does not seem to be any other correlation, as there is no posterior shadowing, so it rules out any possibility of dermoid cyst. This is the urinary bladder in longitudinal section. This is the urinary bladder in transverse section. This is the uterus. Well, this is the transverse section of the uterus, and the area measuring approximately 15.7 is the endometrial canal, which is dilated echogenic, low level echogenic, and definitely more than expected normal. Thank you very much.